Wonderful. So my name is Andrea Crook. I am the Director of Advocacy with Access California. And today joining me is Noah. I'll pass it over to you to introduce yourself.
Hey there, everybody. Good afternoon. My name is Noah Hampton Asmus. I'm the Legislative Policy Analyst.
So just to let you all know, we will be having opportunities to ask questions or provide comments throughout this presentation. When we are providing the presentation, though, we're keeping everybody on mute just to help reduce some of the background noise. When we do unmute everyone, if you aren't providing public comment, feel free to mute yourself just to help kind of reduce any of that background noise. And we appreciate it very much. So again, thank you so much all for joining us. As a brief review, Access California is a program of Cal Voices, and we are a consumer-led stakeholder advocacy program funded by the California Mental Health Services Act and Prop 63 dollars. And our contract is overseen by the Mental Health Services Oversight and Accountability Commission. So you may hear us refer to the MHSA or the OAC because we in behavioral health love our acronyms. So a little bit about Cal Voices. We are a little over 70 years young. We were founded in 1946, and we are the oldest continuously operated consumer advocacy agency in California. We are also a peer-run organization, and what that means is we specifically hire individuals with lived experience from mental illness and living successful lives of recovery. So ACCESS stands for Advancing Client and Community Empowerment through Sustainable Solutions. And I know it's a mouthful, but it is truly what we embrace. We embrace elevating the client's voice and choice always within behavioral health and mental health, public mental health system. I do want to say that it's a mouthful, so call us ACCESS for short. So our values are also our annual themes, advocacy, recovery, and peer support. We are in year 3 of this contract, and what that means is that a lot of our data collection is really around peer support and how that looks now in 2020 after the MHSA passed in 2004. So we kind of want to see where we are today and identify opportunities for growth as well. But all of our work stems around our values. And when we talk about advocacy, we're really talking about meaningful stakeholder participation and active solicitation of community feedback, as well as expanded opportunities for involvement and inclusion at all levels. And when we talk about all levels, we're talking about policy development, program planning and implementation, and service delivery, as well as oversight and administration, so budget allocations, etc. And recovery, we were really focusing on ensuring the infusion of recovery principles in all aspects of service delivery. And so we really want to ensure that that we are, as a public mental health system, both locally and state, tracking meaningful recovery outcomes and reporting on this, and ensuring that we're using these findings to better inform the programs that we're investing in and the programs that we're creating and expanding upon. And when we talk about peer support, we really want to ensure that there is fidelity to the evidence-based model. Although California doesn't have a state-recognized peer certification, we do have a ton of information, and we know that peer support is an evidence-based practice. So we want to do our best to ensure that programs that are utilizing peer providers are really sticking to the fidelity to the evidence-based model. And we want to ensure that there is an incorporation and expansion in all mental health programs, as well as we want to ensure peers are really making a living wage, and that there's opportunities for ongoing professional development, as well as opportunities for advancement. So moving on, today we're going to learn about current Brown Act requirements, MHSA client-driven policy, as well as stakeholder involvement, transparency, networking and connecting, and the digital divide. So part one. With that, I'm going to pass the baton over to Noah.
Hey, good afternoon, everyone. So in this first section, we are going to address the Brown Act open meeting law, Brown Act and Bagley-Keene open meeting laws. The Brown Act refers to the legal work or the legal framework for local jurisdictions, including county and open public meetings. And then the Bagley-Keene refers to public meetings that are held at state level agencies. So we're going to jump in with kind of the open meeting laws and things of that sort. So what it does is requires local agencies to post notices and agendas so that there's enough forward information for the public to decide if they want to attend or if they need to give public comment upon something, which, like it says, ensures citizen and professional involvement and holds public meetings and hearings and encourages community input at meetings. This also includes treating all the documents that are a part of these public discourses as public documents. So you can make public records requests for transcripts or materials that were provided in the public meeting, and things of that sort, as well as meeting minutes to make sure that everything holds true to the way that you imagined it, and then also things like that. I see Hector's note about the executive order. That's exactly what we're going to get into today, is that the executive order changed a little bit of the requirements. Gavin Newsom issued an executive order on March 11th at the beginning of the COVID crisis. What it does is kind of make modifications for teleconferencing and participating at a distance. It does not take away any of the requirements for notification or posting or advance notice for meetings and things of that sort. What it does most generically, and I'll go over the specifics, is that it allows for distance participation. And so because a lot of the meetings were required to be held, or meeting participants were required to congregate in a specific place to be able to participate at designated locations to be considered a part of a public meeting. So this kind of expands it a little bit into a little bit more friendly to participate digitally and at a distance. So specifically, I posted the executive order as a webinar material. So it is available for your review, further review, and you can download it to get the very specifics. Again, I'm not going to say I'm a professional or memorized any of this, but we can go over kind of the general things. So state and local bodies do not have to list each teleconference location from which a member will be participating. This is because additionally, like meeting participants, like for example, if an OAC commissioner needs to participate from his house for an OAC meeting, then you don't want to list a commissioner's home address. Each teleconference location does not have to be accessible. Again, that's because you don't want to list people's houses as an access point for a public meeting. Member of the public may or may not address the body at each teleconference location. So the specifics around being at a specific location are the most restrictive parts of it. So you can't, they don't have to be at a specific location to address the public, but they do still have to be available. State and local bodies do not need to post agendas at locations. Again, no specific location. At least one member of the state body does not have a physical present at the location specified. That's for distance participation. And state and local bodies do not need a quorum within the boundaries of their territory. So for commission meetings and for board of supervisors and other public meetings, it's just kind of extending the parameters for where they can participate. Next slide, please. I see a question from Lorraine. Are notices required to include phone numbers in addition to Zoom and other app links? I would assume for public access, yes, they are probably required, but you'll have to look at the specific language. I don't know if it goes into that great a detail. It just kind of makes sense that they should. Um, so getting back to Governor Newsom's executive order, so the listed suspensions that I went over in the first slide are only if these conditions are met. Each state and local body must give advance notice of public meeting as prescribed in open meeting laws. And each state and local body must notice at least one publicly accessible location to participate and provide public comment. So those are only available, the parameters that were listed on the first slide were the exceptions that were made for at-distance participation in public meetings that are only valid if these two conditions are met. If there's an advance notice and that there is one publicly accessible location, a lot of the times local bodies will use a library or a public building of that sort, whatever might be open at this moment. Again, this was written in March, so we don't know all the details that were specified as far as the restrictive accessibility. And in addition to the mandatory conditions set forth above, all state and local bodies are urged to use sound discretion and to make reasonable efforts to adhere closely and as reasonably possible to the Bagley-Keene Act and Brown Act. So they still have to try their damnedest to be able to be as open and transparent and abide by the Bagley-Keene and Brown Act. So if it seems a little fishy or if there's no real reason for them kind of cutting out access or notice or participation or things of that sort beyond what's reasonably possible, then please raise your concerns. Next slide. So local meetings and local mental health boards and boards of supervisors still have to approve rules and regulations coming from the state direction that affect behavioral health services. So there's, again, it's a kind of top-down approach that the rules and regulations from the state still mean that the local meetings have to participate according to those rules and regulations. And they should continue to meet and include public access and for local mental health boards and boards of supervisors. So if you're getting the runaround and saying that they're not holding meetings or not doing teleconferencing or not having public access, that's not what is required by law at the state level. So look into that and raise some concerns if you're feeling disconnected from your usual advocacy routines.
I just want to pause for a moment before we move on to part 2 and unmute everyone and find out if there are any follow-up questions to what Noah just shared with you or any comments. Okay, so again, feel free to utilize the chat box and we'll be stopping between each section to find out if there are any follow-up questions. So with that, I'm going to go ahead and place everybody back on mute. Except for you, Noah, of course. Okay, so part 2, stakeholder involvement. So when we talk about client driven, the Department of Mental Health, when we still had a Department of Mental Health, a state department back in '05, stated that their needs and preferences drive the policy and financing decisions that affect them. And adult services are client centered, with providers working in full partnership with the clients they serve to develop individualized, comprehensive service plans. So the MHSA, the Mental Health Services Act, it puts clients in the driver's seat. So clients have the primary decision-making role in identifying their needs, preferences, and strengths, and a shared decision-making role in determining the services and supports that are most effective and helpful for them. So programs and services use clients' input as the main factor for planning, for policies, for procedures, for service delivery, for evaluations, and the definition and determination of outcomes. This is so incredibly, uh, was one of the most transformation system transformative legislation that's ever come forward in the eyes of a mental health client. Um, One, MHSA calls for unprecedented numbers of stakeholder involvement, and two, MHSA puts adult mental health clients in the driver's seat. And for youth 0 to 17, it puts their family members in the driver's seat. So this is something that is not an opinion. And as you can see in all of our slides, we cite the sources where we pull the language from, the Welfare and Institution Code, as well as the California Code of Regulations. Um, so it also states in the Welfare and Institution Codes that counties shall demonstrate a partnership with constituents and stakeholders throughout the community program planning process. That includes meaningful stakeholder involvement in mental health policy, program planning, implementation, monitoring. So pretty much are the programs doing what they said they would set out to do, um, as well as quality improvement, evaluation, and budget allocation. And Noah and I feel it's really important to continue to bring this to light because a lot has happened in recent weeks, and a lot has happened since MHSA passed back in '04. And so we want to ensure that the core vision and the core values and the actual law is being upheld to ensure that we are elevating client voice, client choice, and client driven services and practices. I'm about ready to move into part 3, which is transparency. But prior to that, I do want to unmute everyone again to find out if there are any questions or comments with anything that I just covered. You are all unmuted. Okay,
Hi, can you hear me?
I can.
Hi, Andrea. My name is Vanessa Ramos, and I am a great fan of Access. Will
Hi,
you
Vanessa.
please share? Hi. And I heard you yesterday at the MHSOAC, and so many from Access, so way to go. May you please share the question one more time? My sound went off for a little bit.
I was just asking if there were any follow-up questions or comments pertaining to the slides that I just covered.
Andrea, I'm not sure if this is appropriate at this time, but please, reroute me as needed. I do go rogue. But Andrea, the as we as Noah and you kindly share so much, and as I work on a MHSA innovations project, one of the things that I do find is that um, data equity and digital equity is not always considered. meaning that with these motions that get put forward, at times we do not address that people do not have the proper linkages to the resources needed with the work that I'm doing in the county that I serve. I have put my foot down and said I will not talk about any apps until we figure out basics. So I have gone rogue, my friends, and just said, no, we're going to take many steps back and we're going to start teaching on basics like how to create an email, how to link people to laptops and phones, and ensuring that, just usage of that technology is needed. And it gets a little political, so I do want to be careful with my words, but the powers that be already know my stance on that with the agency that was selected to manage such a ginormous project. So as I have my own frustrations, I celebrate the use of technology. It is imperative that we, before we start saying things are done online, simple basics like, do people have the tools needed? And if they do, with Brown Act or public comments, do people even know how to get off mute and do all that and know if they're online? Because that takes away from the time. And I am a person with co-occurring disorders that are only important if you are billing for services for me. I live a very vibrant life, but at times it's hard for me to speak. Does that make sense? So if you're telling me, if I don't know about technology, everything's moving online, and I don't know if this is appropriate for this session, but I
Well,
just
I
wanted
think
to
that,
say,
yes, go ahead and finish your thought.
I, I, I need to know that we are highlighting the need for education regarding technology. Where do I get a laptop? How do I set up an email? Everything's online. How do I visit the website? How do I know? How do I receive the notices? How, you know what I mean? Like, it's like all these little things, and I have a few ideas that I'm going to test out and I have to be careful with, but I will do it because it is important, and strategizing is what I have found works best, because we need, I just have to be careful on how I do it. But when I think of the people, the way is always made available. And with the amazing ambassadors that we have, they make me cry. We have ambassadors that show up with walkers and fucking take the bus and do so much, trusting that their voices are heard. So with that, I say that
Well,
as we move
Vanessa,
to things online, sorry, go, please
no,
stop me because I'll continue.
I appreciate everything that you have to say, and I think that you're in very good company because these are a lot of concerns that we have identified as well, right? And so you're we're hearing you, and so appreciative of you bringing these concerns to light, because these are all of our realities. Um, with that, if I may, I'm going to move to part three. I'm going to definitely loop around and come back, and there'll be more opportunity for us to have further discussion on this. But I do want to be mindful of our time as well together.
Do we have time
Thank
for
you.
one quick question about part two?
Absolutely,
Hello?
please. Yes.
Okay, so one of the problems I've been having in my own county about getting meaningful stakeholder participation is the scheduling of the meeting. They're always scheduled during the weekday. So is there any way we could, any strategies you would suggest for getting our counties to schedule these meetings like on the weekend or weeknights? where it could be more accessible to clients?
I think that's a really good question, and I think that that would be something I would highly recommend talking about during your stakeholder meetings. And really not only just times of the day, but also location, because we know whether you live in an urban or suburban area, transportation can be a barrier. And so by holding meetings at various times of the day, various times of the week, various locations can make a huge impact on ensuring that your diverse communities are able to participate. So I definitely appreciate that question and would love to explore that more with the group. Can we circle back to that and talk about it more when we get through the next sections?
Sure.
All right. Awesome, guys. Thank you so much. I really appreciate your input. I'm going to go ahead and encourage you both to, or all to, continue utilizing the chat box. I see that Noah's been keeping up in here, and then we're going to unmute everyone after the next section as well. All right. And actually, I'm gonna let you guys, this is actually really good. We did a webinar earlier and there was a lot of background noise. I'm not hearing any background noise here, so I'm not gonna worry about putting everyone on mute unless it starts to get to a point where we can't hear each other, okay? So with that, I'm gonna go ahead and move on to transparency. All right, so I would love our little bubbles and our little visuals because it just really speaks to the larger MHSA funding. And so if you're looking at like the green bubble, that is your county's annual like allocation of MHSA dollars. And then 20% of that goes to PEI, and then 80% of that goes to CSS, as well as all of the other components like innovation, capital facilities and technology, WET, prudent reserve, and the community planning process. And so we do want to say that, you know, we hear oftentimes from counties that, you know, the community planning process, we know and we understand that the community planning process takes a lot of resources, a lot of time, and it's not just for identifying program needs, it's also about ensuring that we're having individuals provide ongoing oversight, ongoing fiscal oversight, program oversight, quality control. And there are funds set aside for that, and that would be 5% allocation based on 5% of your annual county allocation. Now, we do have a fiscal transparency tool suite now that the OAC has provided. If you go to mhsoac.ca.gov, and maybe Noah, you can type that in the chat box for me. You can go to their fiscal transparency tool suite to see how much money your county has for the community planning process. But that money is really to be used by the county to develop their 3-year program and expenditure plans, as well as their annual updates in partnerships with stakeholders to identify community issues related to mental illness resulting from lack of community services and supports, including any issues identified during the implementation of the MHSA. It's also used dollars to be used to provide transparency to the public about how Mental Health Services Act funds are spent. So again, when we talk about transparency, we're talking about publishing meeting times and agendas on a website is best because it allows for advance notice. It is instant and done in hours. It doesn't need to be updated after posting. It's automatically archived. However, there are limitations to access, such as, you know, many of the limitations that Vanessa, you touched on earlier so eloquently. Other ways to really ensure the transparency is by newspaper publishing. It is the traditional form of announcement to reach non-digital users. And it also can always can ensure advance notice. It can be repeated daily or weekly. And if it only runs once as a story, it needs to be ongoing. So calendar updates and legal ads. And Noah, is there anything that you wanted to elaborate on this slide in particular?
What I wanted to highlight was that there are ways that it's done traditionally and most accessibly, which is through a website, and that's all well and good. But as you mentioned, and we're going to touch on it a little bit more about non-digital users and people that are affected by the digital divide that don't have access to that. I think it's overlooked that newspapers are a really great resource for our community, and that there are opportunities with those. And these are advocacy points for you and others to say, you know, maybe you're not reaching out to all the community members you think you are with a website, and that's important. And you bring up digital literacy and even access to that degree. And that's, I think, a really good point of advocacy.
Absolutely. So with that, we're going to move into part 4, networking and connecting. But I do want to find out if there are any questions or comments before we proceed.
Yeah, I'd like to comment. My name is Pete Thompson,
Hi, Pete.
and I was just feeling as though, as a client of the mental health stakeholder, that I wish there was a little more faith-based therapy going on in our community. Not necessarily, you know, with the religious view on marriage, but more spirituality and faith in orientation of our community. I think it'd be helpful to have people live healthier lives and be more connected socially with each other, and as well as helping the homeless get place to stay and off the street. But anyway, I just made a comment. Thank you.
Thank you so much for sharing that. Absolutely. Very important. Anybody else like to share or have any questions?
I'm sorry, I don't want to be monopolized, but I feel like I'm like with people I should have connected with a long time ago. But as someone who works in the county and as someone who works with the MHSA chief and has did the CPP process, one of the things that I think is very helpful is if a checklist is created, and maybe this is, you know, again, different conversation, but sometimes there's barriers like this. Like I may really want to share all the meetings that are going on the county website, but there's like I don't have access to what gets posted, so I have to go through county IT to the PIO through the da da da. Do you see what I'm saying? So like
Absolutely, I do.
can that ever be like coordinated? And even like with they said faith-based groups, like a checklist of like, are you reaching this person and that person? Because our access ambassadors were like, we need a work group, and they got the MHSA chief to do work group, and they highlighted childcare, nighttime, library, by the bus stop, and that's why we have a robust plan. But like the specific points, not just like, I don't know if that made sorry if that made sense.
It does. That makes perfect sense. Thank you again for
Yeah.
highlighting that.
Hi, how are you? My name's Nancy.
Hi, Nancy.
Hi, how are you? I struggled for many years with affective, and I want to be more proactive.
Nancy, I'm sorry, but it sounds like you're in a tunnel. Is your mic on or close to your mouth?
Yeah,
There
I'll
you
just
go.
turn off
Now we
the
can
mic.
hear you.
I am so sorry, these phones.
I get it.
Yes, I want to be more proactive and, giving back, community, and also because I see everything that's happening with mental health. We need more treatment and everything. You know, it's very important. And I, with me, I love staying active. Being involved in the community and just, you know, each day a little bit better. It's treatment is very important.
Thank you, Nancy.
Thank you.
Okay, so we could take one more, and then we're going to move into part 4. Okay, so it doesn't sound like we have anything else right now. Again, feel free to utilize our chat box if you wouldn't mind muting yourself until we open it up again for Q&A, and I'll go ahead and pass the baton to Noah. Take it away.
Thank you. So what we're going to address on part 4 are things that you know about already. Mostly this is for networking and communication and to be able to stay in collaboration with your fellow stakeholders and advocates, as well as to pay attention to where information is coming from. So these are just quick recommendations that you're probably all very well aware of. And that's many government departments use an email listserv to send notifications to stakeholders. So you want to be sure to jump on their website and try and find a subscription list or something that you can get connected with. Often in local counties, it's the MHSA coordinator who has an email list for meeting announcements and notifications. And like I said, there might be a subscription bar on websites. Next, please. So we are in a brave new world with social media as well. So there are a number of different ways to communicate in just about any format. Facebook, Twitter, and Instagram are 3 of the most popular, and those allow for departments to provide instant updates and announcements. There are different ways to do it. Facebook allows longer notifications with links and graphics. Twitter allows shorter notifications with links and graphics. And Instagram is about photo sharing platform with links and graphics. So if they're telling you they don't know how to reach out to people, they haven't been present in the 21st century by any means. There are plenty of ways to make sure that people are receiving the news from local county organizations and things of that sort to find stakeholders and make sure that the public knows what they are doing.
Thank you, Noah. I just wanted to pause for a moment. I apologize before I move to the next slide. We do have a hand up, and I'm not sure if I missed it earlier, but it was Richard Fleming. Did you have a question or a comment before we move forward?
Oh, sorry, no, that was accidental.
Oh, okay. Thank you. All right, go ahead, Noah.
Let's see. So, and then with social media, you'll also find that there are chat platforms on the next slide, if you could. This is ways to be able to stay connected with stakeholders and on remote or desktop devices. They provide digital conference calls with an option for video on smartphones or desktop devices. So there are opportunities to always get a hold of each other in more ways than just a simple phone call or a text message. If the devices allow it and things of that sort, we know that there's limited data, of course, there's limited access, but these are ways to network, and I'm kind of almost talking to some of our ambassadors about if they need to meet their networking deliverables, they can set up digital conferencings with chat platforms and things of that sort if they're connected online. That's a good way to stay close to your stakeholders and make sure you're all on the same page for your next bit of advocacy. Also with digital conferencing, we're going to step into a number of different platforms that are available depending on your subscriptions or your availability. So Zoom is one of them that we use here with Access California to provide our meetings, and we get a chance to see everybody's faces if they're available online, and have an open and free discussion with our stakeholders, and then and that's available if it's free or paid. Can you go back so I can just touch back on Zoom?
Sorry, you're happy. There you go.
So it's a free or paid platform. If it's free, then you're limited to 40-minute discussion. If you're paid, then you have unlimited meeting time. This does have really great control functions as far as being able to have a host. And the important part is that it's available for any email user because it uses an online platform through the internet. But one thing that you do have to be aware of is Zoom bombing. It's become more popular now that COVID and more remote meetings are happening. Where if you publish your meeting access keys and details, then some dang teenagers are going to Zoom bomb your meeting. And we'll jump onto Google Hangouts next. So Google Hangouts is another chat platform. They recently opened up video conferencing and meeting rooms. It's available through the Google Suite. So if you have Google email addresses, this is all free and available to you. Each individual ends up controlling their video feed. There are no time limitations and can support large groups or meetings. It can be recorded and distributed through Google and is available on mobile and desktop accessibility.
Okay, so Noah, I haven't utilized Google Hangouts, so I have a question, and they always say if somebody has it, maybe others do.
Sure.
For Google Hangouts, does everybody have to have a Google account? Like, I know it supports large groups, but can anybody participate, or do they have to do it through a Google account?
It's a Google account specific.
Okay, thank you.
Next, please. So then one of the older platforms that was developed early through for teleconferencing or online conversations was Skype. It's a networking-based program where you make online calls, and it's accessible through the Microsoft Office accounts. So those are mostly available to those that have Microsoft Office available on their desktop or PC or their digital device as well. Skype comes with a package. It is by invite only, so you need to know your users ahead of time. And it's usually just for small groups, but it is available. Some larger meetings, we're hosting Skype meetings before, where each individual controls their video feed. It is free with the Microsoft Office availability. There's no time limitations, and it's available on mobile and desktop accounts. Next, please. And so we touched on social media a little bit. This is one of the newer platforms that ended up presenting video conference calls. I know some people actually prefer it rather than some of the video chat platforms for phone or for Android or Apple phones. It's a platform that works through Facebook chat, which is called Messenger. It is by invite only, and you need to know who you're going to reach out to or to be able to find them online. Each person is in control of their video feed. It is free. There are no time limits, and it's available on mobile and desktop devices. And teleconferencing is what we're most used to as far as being a part of open meetings for remote meetings. Those are held through online, or excuse me, phone companies host conference systems that allow multiple people to join, and is an analog system, usually by subscription or a part of your carrier's packaging. Many phone carriers and devices allow for merge calls with multiple participants. However, the numbers are limited depending on the carrier. And there are also drawbacks to not being able to interact with video. And there are many interruptions to meeting flow, especially as we have learned over a number of years of teleconferencing. So this slide is a little matrix of those that, if the presenter has high access and high technology skills, or the presenter has low access and low technology skills. It's just for your reference, and you're able to download these slides. It gives you some ideas about which platforms would be most beneficial for the populations that you're trying to reach, or how they might be utilized. And I think that wraps up that section. Any questions?
This is Carol. I'm thinking there is a lot of technology to be learnt, and I'm wondering if there's a way that we can either get resources put together or start a resource page somewhere on, you know, how to do all of these things.
As far as resources, that's kind of a hard question, and we're going to jump into it a little bit with the digital divide in this next section. It's hard because everything costs money, and it's on a private, it's in the private sector as far as development and things of that sort. So being able to find cheap resources work best through group pricing and things of that sort, but that might be something that the county or organization would have to purchase itself. Does that help? All right.
Yeah.
So the digital divide is kind of a term that's been that connotates that internet is not a universal utility, and that there are people that are, although we live in a digital world, they don't have the same access or ability to participate in the digital world. There are several barriers to internet access, which include cost, location, devices, necessary bandwidth for certain applications. Tech skills and digital literacy is a large part of it. So we understand that it's hard to overcome, but that's part of the advocacy opportunities that we added through transparency, is that there are other options that are of older media, like newspapers or public access resources, that are available to be able to kind of make sure that more populations are being reached out to. Next slide, please. So just to give you some food for thought, this is how big the digital divide is in California. There are approximately 5 issues that expand the size of 5 different states in California with the problems that are happening in the digital divide access. Though most demographic groups have seen increases in broadband subscriptions at home, gaps persist for low income, low educated, rural, African American, and Latino households. Between 54% and 67% of these households have broadband subscriptions in 2017, compared to a 74% for all households. Among low-income households without broadband, 53% cited lack of interest, and 25% cited lack of affordability, as a key barriers. And notably, these households were more likely to rely on cell phones rather than desktop devices to access the internet. So, I mean, it's a huge thing to overcome, and I see there's a couple of questions. in the chat box, and we can open it up for discussion, because I don't have specific answers for to overcome this, but it's one of the things that a lot of great policy minds are trying to work for. So what is the easiest way to poll communities on what digital platforms they have access to? So there are doodle polls, as Jacob mentioned. They're available for kind of quick and easy polls. There's also ways that you can create surveys through Google Forms, which is an opportunity that not too many people use or took advantage of, so they kind of rebuilt the platform. But it is actually a really great tool and public access if you have a Google account or the Google Suite access. ADA accommodation is not my strong suit, so I would have to defer to disability rights. I don't know exactly how to make accommodations. That's just not my strong suit. It looks like Richard Fleming added a handbook that was available for Zoom meetings.
So there's a federal program called the Video Relay Services where they set them up with a translator and everything. Goes into detail.
And thank you. And like I said, the digital divide is something that a lot of smart people are trying to figure out how to overcome, because as one of the largest labor market systems, the middle skills jobs, which require no college degree but pay above average, and they overwhelmingly rely on digital skills. So it's an economic issue, it's an advocacy issue, it's a notifications issue. It really is a huge part of being able to create a better community and a more productive economy as well. The statistics that I found is that about half of adults have insufficient digital readiness for using digital tools to learn new skills. And among low-income households that make $20,000 annually or less, only 59% have a home broadband subscription, compared to 88% for all other households. So you can see that it's definitely an economic issue. So there are pushes for public policy to institute universal broadband and to create public cable and internet services as a public utility system. There are also increasing tools and access for computer literacy in school programs to be able to encourage growth with digital access.
Noah, we lost you. Are you there? I think we lost you, Noah. So I'm going to go ahead and as we wait for Noah to regain his mic access, I'm going to go ahead and open it up to folks for questions and comments.
There's a $101 million project that's going on, and it is MHSA funded. Can a suggestion to have that very large project create a survey, or was the county surveyed on that digital divide? Like, is it, knowing what we know now, can the project be asked to create a survey to survey the counties that are involved in a very large project? I manage the project locally, and I don't know if that's something that maybe this body could ask for that very large project that's MHSA Innovations funded.
I think that's a great point. And if you've been following any of our advocacy and policy work, you will see that we have a lot of information and position papers around that. And we do encourage folks to attend the Oversight and Accountability commission meetings, and if it's not on the agenda, there's always general public comment and opportunities to provide recommendations, and I think that would be really meaningful to have more voices heard, because there are a lot of barriers when we were talking about digital divide. So thank you for that. Because yes, we need to raise greater awareness. Anyone else?
This is Carol.
So,
Go ahead, the gentleman, and then we'll move to Carol.
so this is Richard. I just wanted to share one of the outreach methods we've been using for people on the low end of the digital divide. We found that a lot of our clients have trouble using email, so we figured out how to do email to text. So we're able to reach out to send them text messages on their cell phone with our work email account, and I'll paste the link of how to do it there. But it's something we found that worked really well with some of our clients who aren't very tech savvy, and it's been able them to participate in our various activities over Zoom.
So when you say emails to text, are you saying you're showing them how to do that with their smartphones?
So what it is that every cell phone provider has their own email gateway, and you can send a short email. It's like limited to 160 characters, and it'll show up on their phone as a text message. So that way we can reach out to them electronically, even if they're not able to use email.
Oh, that's awesome! Thank you. That's great information.
Yeah.
Thank you, Richard. Carol?
Yeah, I was just one of the things that I've run into recently is trying to get somebody set up. They were going to use their stimulus funds to get a laptop or a tablet, but because of COVID, the technical service was not available to help them in their home. This is a senior, so I'm wondering if people, well, I guess I'm just saying that in it's kind of like a catch-22, because you're housebound and unable to get out, or unable to get to meeting locations. People are wanting to go digital, but because they're self-isolating, because they're older or have chronic conditions, they themselves can't get out, or people are not willing to go to them to help them with the technical side of getting these things set up.
Well, I can tell you, Carol, that we do have many programs within Cal Voices that provide direct service, and for our programs that provide direct services, we have been able to purchase laptops, or not laptops, I want to say tablets. You can get them for between $40 and $50. And what we've done is we've actually set them up for individuals and downloaded the Zoom app. And we've been able to do it while maintaining social distance and delivering on doorsteps and providing TA with social distancing in place. And it's been incredibly helpful, not only for folks to be able to access peer support groups, but to just maintain connections. And they're now able to even do participate in community planning meetings, and as well as meet with their providers. So that's something that can work, but and it's something that you can advocate for at the local level too. To this is what MHSA dollars are for, to be able to support individuals and to help address those barriers that they have. So thank you, Carol. There are workarounds, and we just have to be creative, and we need to ensure that we're sharing these cool ideas that folks have been creative with across the state.
I'm wondering if
time for another.
Sorry, I was just going to ask if maybe after this meeting I can contact you, or through email get a link to how you do that.
Yeah, absolutely, Carol. I'd be happy to chat with you.
Great, thank you.
Is there time for another share?
Yes, please.
Yeah, I was this dealing with technology, concentration among the mentally ill can be a big issue. I think the issue of post-traumatic stress disorder and traumatic experiences in the childhood of sometimes sex abuse can affect concentration and disassociation, and and the issue is not always talked about. Dealing with triggers and different issues. Thank you.
Thank you very much. I want to say we are. I am going to stay on if there's any other questions or comments or feedback. I do want to let folks know that, and I'm trying to get to the next slide, but there we go. Here's our contact information. Feel free to email or give us a call or follow us on social media. But we would love to continue these conversations, talk about these real barriers, and find creative solutions. So again, thank you all for joining us. And if there are any further questions or comments, now's the time.
You have access to a program where you get clients $50 laptops. Can you explain more about that?
We have programs where we provide direct services in partnership with the county. These are MHSA programs, or we have peer partner specialists. And during COVID, we were able to support individuals by providing them with notebooks.
Okay. Okay. I didn't know that was something that could be done with MHSA dollars.
Oh, absolutely. It's MHSA is about whatever it takes, right? And so it's about and it was funds created to fill those gaps for what historically would have been a barrier to purchase a notebook. But yeah, for sure, it is wonderful to have that ability.
We're building out the digital empowerment toolboxes and digital wellness toolboxes, and we're having stakeholders help build. It was approved that I can have the stakeholders help me build. So the Access ambassadors for us are Jacob McDuffie and Chuck Hughes, and if they join that conversation, with them learning, maybe they could be utilized to share that information back with you guys. But we're doing work to get free to low cost items. But thank you for being here. This is my first conference. I'm so excited. But there are a lot of there are companies that are doing things. I trust Painted Brain. They're a peer-run organization, and they have a lot of tech links. I could share their information with you guys in the email, and
that would be wonderful, Vanessa. We would love to hear more from you and get those resources. Thank you. Thank you for being here. Anyone else? Noah, I see that you were able to log back on. Do you have any final words of wisdom?
No, I just wanted to say thank you for participating. I hope you learned something and walked away with some advocacy tools or networking tools that you might not have thought of. And there's definitely more work to be done, but that's what we're here to do.
Thank you, Noah, and thank you all. Have a wonderful afternoon and stay safe out there.
So excited about your conferences. Yay, Access! Hooray! I can't wait. I swear, we're so happy for you guys to come to Santa Barbara. But can't wait to see you all on Zoom.
Thank you. We look forward to it.
Bye.
Bye. Bye, everyone.